I am excited to interview Dr. Jason Auerbach, and he is also known as the Bloody Tooth Guy. I have watched him be censored on Instagram. Thank you for agreeing to be a guest on the podcast.
Of course, looking forward to it. Thank you so much for having me. Really looking forward to it.
So, tell us a little bit about how you got started and how the Bloody Tooth Guy came about, where that just kind of blew up on you.
Yeah, sure. So I don't know how much of your audience knows about the specialty, so I'll even start kind of before that. So oral maxillofacial surgery is the surgical arm of the dental profession. It's kind of a hybrid specialty and somewhere between medicine, surgery, and dentistry. But basically, we take care of everything kind of above the clavicles and in front of the ears. We all, irrespective of the length of the procedure of the program that we're in. We all have a ton of hospital training, residency-based training, and do some stuff in residency that many of us don't continue to do in private practice, but much of our specialty and the beauty of our specialty is that kind of there's this full scope concept where some of us are doing facial cosmetic surgery, many of us are doing dental alveolar surgery, which people think of as like teeth, wisdom teeth, tooth extractions and bone grafting and dental implants and things like that. But there's also microvascular surgery, basically facial reconstruction. Obviously, we treat a lot of trauma and we do a lot of anesthesia. So it's a full scope. I personally think, and I would say most oral surgeons feel this way, that it's the best specialty in all of healthcare. I'm honored and humbled actually to be able to do it every day. And so that's what oral surgery is. So in the office that I'm currently sitting in, which is in Bergen County, New Jersey, which is 6 miles from the George Washington Bridge, anybody knows that's the access point to the city, Manhattan. And I'm sitting here about 8, 9 years ago with a couple of young kids. My daughters are now in late teens, 20s, but at the time they were just kind of getting started on Instagram. I had a personal Instagram account. I saw that people were interested in this concept of like popping pimples, and there were very few dental quote unquote influencers at the time. Those that were influencing were doing more lifestyle type of stuff rather than the dental piece. So I figured like if people are interested in watching people pop pimples, maybe they'd be interested in seeing bloody teeth. And it caught on, and it was interesting to, most surgical minded dentists. There's been kind of a surge in this concept of interest in surgery. I think it's gone hand in hand with the uptick in dental implants and the rise thereof. But many young dentists do a lot of their own surgery. And so I was kind of an avenue for them to learn outside of the classroom. And that's my account has become, I guess, primarily an educational one where surgically minded dentists and other dental professionals are learning, what is oral surgery and you know, from the techniques to lifestyle and everything there in between.
And I think that that's very interesting. And like you said, I think that a lot of healthcare these days, everything's treated by the niche and by the symptom. And so we kind of all have to work together in a collaboration. And you bring a good point. Like our generation, my generation growing up, when they had a problem, a lot of times they didn't save a tooth, they just took it out.
Right.
And so now they're having a lot of health issues because they're not able to chew and the teeth are shifting and they have gut issues. And so I go from a holistic approach and what can you do? And now we need to replace those. So obviously the best thing to do is to prevention and save teeth. But a lot of things that people don't know a lot about and what we talk about in the community that I serve are what happens when you can't afford to fix the tooth and now you need an implant, but now an implant is going to be more expensive.
Yeah, I mean, so I think you hit the nail on the head. I mean, it all starts with prevention, which means access to care. And a lot of people, some people don't have access to care based on their circumstances, and some people don't choose to have access to care because of either fear or misconception or previous experiences that were, let's say, suboptimal. And I think really the key is to get ahead of it. I mean, oral maxillofacial surgery will always exist going forward, hopefully anyway. But the fact of the matter is that it exists. It should really only exist when all other kind of very early stage stuff has been dealt with. So most people understand, I believe, and I hope that if you take care of your teeth and you maintain your oral health overall, generally speaking, the things that pop up will be caught when they're early, and those things require very, very small little fixes. Once things are let go, that's when big problems can arise. And when people think about dental abscesses, that's like a local infection associated with a tooth. But those things can become much more severe relatively quickly. And I'm not an alarmist, but dental infections, just based on their proximity to certain anatomic structures in the head and neck, can become concerning and dangerous and require surgical intervention. Once you're at a point where you're having a tooth extracted, and you're considering, the way to replace a tooth, or considering a root canal, endodontic treatment, or whatever it is, if you have to have your tooth extracted, then typically what we do is we try to maintain as much or rebuild as much bone, because oftentimes if a tooth is infected, a lot of the bone is infected as well, affected as well. And then we have options in terms of tooth replacement. It used to be either a removable prosthesis, aka a denture, or a bridge, which requires grinding down adjacent teeth and putting crowns and kind of soldering a tooth between, which has benefits but also some negative sequelae. Or dental implant. And as more and more people are becoming more concerned about kind of what they're putting into their body, rightfully so, there are alternative materials that have come into play as it relates to engineering and design of these tooth replacement devices, dental implants. And one of those is like a ceramic, which you would call zirconium. And so the fact is that there are options out there for people who either are sensitive to, have an aversion to, or just for whatever preference would prefer not to use metal. There are options, and we, as oral maxillofacial surgeons, especially those of us who are focused on that type of stuff, are adept at handling those situations.
Yeah, and that's good. And you mentioned earlier too that, you are basically the last option when you don't have any other options that are coming up for a patient to go to if they've waited, because a lot of people feel in the mouth, no pain, no problem. And we treat the mouth separate from the rest of the body. But it is the entry point of almost everything we do: airway, breathing, food, life. So it's important that we take care of our mouth. And you kind of mentioned that we weren't talking a lot about that. And now we're seeing more and more of the connection that the mouth has to the rest of the body. And, most people know oral surgeons just for extracting wisdom teeth.
Correct.
And, we try to save teeth as much as possible, but we get to the point to where we need to have them out. And where oral surgeons come in are that fear factor. There are a lot of people that are afraid of the dentist, and you can then put them under and make that fear kind of go away. And you are highly trained to be able to give them what they need to alleviate that fear, but then give them gas or put them under.
That's
So
right.
tell us a little bit about that and how we can alleviate fears when people do have that they can't, they have those options.
Yeah, I would kind of I would caution patients, because there are a lot of practitioners. This is not anti people who are properly trained. This is how I really feel about it. As somebody who's kind of gone through the chairs on my state department of anesthesia and things like that. Oral maxillofacial surgeons are uniquely qualified among dentists to provide anesthesia. And we talk about true sedation anesthesia, intravenous sedation. We understand the pharmacodynamics. We understand the pharmacokinetics. We understand the art and science of anesthesia. We take it very seriously. We're trained in all things emergency management. And are capable of handling airway and God forbid emergency situations in the outpatient setting. And so I think that's very, very important. I want to kind of lead with that to say there are many different steps before you get to IV sedation, and then even within IV sedation, there's a continuum and a spectrum, if you will, of till you get to general anesthesia, of the type of anesthesia that we can provide, or that is provided by practitioners. But I would say kind of the beauty of it is that there are options out there in terms of oral sedation, which a lot of dentists use, and so long as they're properly trained on how to handle emergency management and patient assessment and things like that, that's appropriate. But in an oral surgeon's office, You can be comfortable, quote unquote, asleep, but basically sedated and comfortable safely. And so things can be done in our office that are not done routinely in the outpatient setting because of our exposure to and comfort with outpatient anesthesia. But I think the point that you made leading into the anesthesia point, which is to say that the oral cavity is the gateway to the whole system. I think that's something that bears further discussion and the mouth is we talk about gut health is such a huge piece of what we talk about now, and airway, and we speak about sleep, importance of that, and just everything, nutrition, overall wellness, holistic approach to that. The mouth is something that most medical doctors get maybe 2 days of instruction on in medical school. So it's a place that you look through. Every single person's been to a medical doctor, like open your mouth, lift your tongue. They get the little pen light, they can't see anything, and that's no knock on our medical doctor colleagues. They're brilliant and save our lives. I mean it's obviously an incredible profession for sure, but the problem is that a lot of people kind of have for many, many years kind of overlooked the mouth and what the health of the mouth indicates. There's been a lot of talk about, correlation between inflammation in the mouth and overall inflammation, periodontal disease, and, maybe some cardiovascular issues. And people know about history of, people who have cardiac issues and going to the dentist, or orthopedic issues and going to the dentist, and antibiotics and all this kind of stuff. But I think it really is very important to understand that the health of the oral cavity is not just correlated to the overall health, but sometimes causative, and a majorly an indicator of what you can see kind of overall. And so I think more and more people are becoming more aware of that. I think more of those who are in the spotlight on the health side of things, like Atia and those guys who speak about overall health and wellness, in these settings, as they become more aware and are speaking to people who are similarly minded, I think more of the population becomes educated.
I agree. I agree. And so, if you were speaking to moms, what would you tell them? What would you want them to know when it comes to their oral health and their kids' oral health?
So listen, I think with the kids, it starts early. And I think and I know that's been preached for a long time. Get the children in early, get them exposed to the dental health environment and taking very good care of their mouths and all of that at an early age. Because when the dental appointment is uneventful and it's really just kind of a look-see and a checkout, they don't develop the fear. If the first or second time that they're going to the dentist is when a tooth needs to be extracted, or their tooth is in pain and decayed and it's reactive, the kid is already excited. The experience is a negative one and can be. Um, and I think really just kind of getting in early for them, routine and regular exams, just like you would for your eyes, just like you would for, female reproductive health. The fact of the matter is that looking and seeing before things happen, just be vigilant. If you have like something in your mouth, a little lump or a little bump, have it checked out. If there's something different in terms of pigmentation or an ulceration or something that you think, even if you're just kind of questioning, is this normal? There is a zero downside in having it looked at by a dental professional first. Your dental hygienist. I mean, you'll go to see your general dentist, and the general dentist will have the hygienist do, exam, maintenance, whatever it is. But I think people don't necessarily understand how important the hygienist is in the overall health picture. Certainly in the dental health picture, they're the first to they know you the best. They identify with you. You have relationships. They know you over a long period of time. For the most part, and they are seeing a lot of things, and I think it's really important to identify that and to lean on that as a dental community, because hygienists are like the gateway, if you will, into what we say.
I agree. That's a good answer. And
Well,
so,
thank you.
another question come in while you were talking. So one thing you mentioned is, all professionals, whether it be dental, doctor, whatever, are not created equal. We know what we know based on what we were taught, based on our personal experiences. So a lot of times you don't get the same information. They were asking, When would you recommend, as an oral surgeon, having your wisdom teeth looked at to be removed? In your teen years, waiting till they erupt? Are you having a problem? What would your answer be for when to start to look for when should wisdom teeth be removed?
Yeah. So the standard imaging that most dentists are using to identify wisdom teeth that's been around for a long period of time are panoramic X-rays, otherwise called Panorexes. Basically, it's a large panoramic two-dimensional picture of the kind of mid-face and lower jaw behind all the way to the condyles, which is the part of the lower jaw that articulates with the skull, the TMJ, if you will. Um, and basically, if you have that evaluated by an oral surgeon, you will have an understanding probably by your mid to late teens as to whether, and that'll catch most of this stuff. Here's the thing: a lot of oral surgeons are they talk about like the consequences of what could happen if you don't act, and that is a real thing. That is a big situation. But the concept here is identifying potential risk before those risks occur. So teeth erupt, lower wisdom teeth or all teeth erupt as a result or as a reaction to root development. So if the area where a tooth is going to erupt is not blocked by anything, the roots develop, the tooth comes into the mouth, everything is good, no issues whatsoever. But wisdom teeth, especially in the day where a lot of people are orthodontically corrected and therefore there's less space for their wisdom teeth, a lot of times they come in at an angle facing forward or whatever. And as such, they become impacted, meaning they get blocked from coming in. So the roots continue their downward development, which puts them in much closer proximity to something called an inferior alveolar nerve, which is a nerve that comes off of a cranial nerve, which gives sensation to your lower lip and chin. And once those roots develop and get lower and get closer to those nerves, removing the teeth becomes risky. And we see a lot of patients in their 20s, in their early 30s, and even of course later, who have teeth that like were partially erupted but still mostly impacted with now very long roots in close proximity to the nerve. And it puts those patients at significant risk for something called paresthesia, which is numbness or tingling of their lower lip and their chin. So realistically, to answer your question, I like to see kids in their mid to late teens. I usually don't act until the roots are half to two-thirds formed. It's just kind of the way I see it, as being, again, getting ahead of it, but not being too preemptive. Oftentimes, upper wisdom teeth are too high up when the lower wisdom teeth may be ready to come out. So it's an art and it's a science. Fortunately, now we don't just have the panoramic X-ray. All of our offices have cone beam CTs, which yield 3D images, allow us to better quantify our risk for that nerve, because sometimes the nerve and the roots are superimposed on a two-dimensional X-ray, but are actually very far away from one another. So the concern isn't really what it needs to be, or overly concerned. So the CBCT has helped us in every aspect of dentistry. And I would say this, I've been on record as saying this, it should be the standard of care in dentistry. That the CBCT has helped us identify those teeth that do and do not need to be extracted, or do not need to be extracted now.
And that's a good point. Two-dimensional x-rays versus three-dimensional x-rays. I think that the CBCT has made a huge difference. And that's
Yeah.
the answer, waiting until the roots are at least a little bit developed, halfway
Yeah.
or three-quarters. But I had another question come in, which is a good question, and I do not know the answer to this. Is there a risk of taking out wisdom teeth too early on kids not developed?
Of course, there are risks in dealing with things too early. When upper wisdom teeth are not yet significantly developed, they have a greater risk of being displaced up into the sinus, or even into more challenging spaces in the head, especially in inexperienced or surgeons, or people who are not actually truly oral maxillofacial surgeons, who are doing wisdom teeth early on in their career or without much experience. And yeah, I mean, I guess if the teeth are underdeveloped and you're not completely removing the follicle of the tooth, and you leave that behind, and you can get the cells in the follicle to form other issues, yes, that is could be a significant concern as well. But again, in most cases, if you're dealing with a trained board certified oral maxillofacial surgeon, they are aware and they're thinking through this. So even though they may not be speaking it when they tell you need your wisdom teeth out, they're not telling you also they're cleaning out the socket and making sure that all the soft tissue is debrided from the socket and all of that. But the good ones are doing that, and again, you spoke to not everyone's created equal. The beauty of oral maxillofacial surgery as a specialty is that even those among us who maybe have different aptitudes in terms of their hand skills or their brain or whatever it is, the training is so exceptional in the hospital setting that in most cases you could be very confident that if you're seeing a board certified oral maxillofacial surgeon, you're being well treated.
Yeah, that's a good answer. And I had never heard that or asked that question before. So that was good. Thank you for answering that. I have another one that is a really great question. Thanks for asking, Diana. So what happens if the oral surgeon tells you that the tooth is wrapped around the nerve? It's not a good idea to get it out, but it's partially erupted. So I've seen where they go in and they take off part of the tooth and they just let it cover back up. But what would your answer be to that?
Yeah. So the first thing I would do is I would want to make sure through CBCT that that was the fact. Again, if you look at a two-dimensional X-ray, like a lot of people will come to me and say, my dentist said it's so close to the nerve, it's too risky, and I'll take a CBCT, and lo and behold, the roots are sitting, let's say, to the tongue side and the nerve to the cheek, or vice versa. And though they look close on two dimensions, they're really not concerning so long as you know how to approach the tooth. So that's the number one thing. Actually confirm that. Like your dentist saying it looks close, sometimes yes, but sometimes no. So that's that. Number two is what you're talking about. It's called a coronectomy. There's a lot of data on the success rate of coronectomies. I have been, honestly, in my career, there's probably, if you were to track kind of the number of coronectomies per unit, per visits that I've seen, they have risen despite my better improved access visually through CBCT. And it's because I've seen them work anecdotally, of course. And again, the data proves it out. So the difference between the coronectomy and a tooth extraction is you're basically removing the tooth. You have to do it in a prescribed way so that the bone height relative to what you leave behind is a certain measurement, and the follow-up is different. And you're also having to deal with the fact, like, you can have a tooth that's partially erupted so long as you can tighten up the tissue and get primary closure and bring the roots down there. But if there's any symptom or any sign of any infection and the roots theoretically colonized by bacteria, you're going to have this kind of root stuck in the jaw, and that's not a good thing. Again, the kind of the beauty of, it's good that doctors, dentists, patients are concerned and aware of this inferior alveolar nerve issue in terms of post-op paresthesia, but I don't want to say it's overblown. It's not overblown, but if you're well trained and you do enough of them, you know that you might see temporary paresthesia here and there. The odds of you having a long-term or God forbid permanent nerve related issue are very low in the right hands. And obviously we need to do coronectomy sometimes. So by and large, if a tooth requires extraction, we extract it.
That's a phenomenal answer. And I've been a dental hygienist for over 35 years. I've only seen that done once, and it was successful. He was having periodontal issues around it, and they said they did not recommend having it taken out. So that was a great question. Thanks for sending that in, and thanks for answering that.
Of
Uh,
course.
but like you said, I think I've only seen paresthesia once also with having wisdom tooth removed, and it did come back after a
Yeah.
couple of years. So I haven't ever. One of my close friends, her husband is an oral surgeon, and I've never seen someone be numb for life from getting wisdom teeth taken out. Have you?
Yeah, it happens. Thank God I've never had one, but it happens. We do see it. Though you can see it just from an injection. So there's this perception that, we're going to go in and cut the nerve or something like that. What actually usually will happen is either the root surface and the myelin sheath, the sheath that surrounds the nerve, are, in contact with one another. So even if you're just taking the tooth out without any, aggressive move or anything like that, sometimes you could have an interruption in the myelin sheath. If you have an interruption in the myelin sheath, which is how the nerve kind of literally hops down, and the stimulus or the impulses travels, you can actually have this interrupted or augmented change in, sensation. But as the sheath repairs itself or the nerve repairs, it's, you get generally full. It's age dependent, it's health dependent, it's actually the level of nerve injury dependent. So there's a lot of different variables, but generally speaking, it's an interruption or pressure on the myelin sheath, an interruption in it. The myelin sheath heals itself, and then back to normal. That's kind of what happens in most cases.
I agree. So, I mean, I do feel that there are some of those stories out there where people have said things and it does create that fear. But in general, that hasn't been my experience for what I'm seeing. So, again,
Yeah.
that's a good answer.
Thank
So,
you.
what other advice would you give parents or someone who's looking for an oral surgeon? What should they look for? And maybe questions they should ask to alleviate that fear or calm them if they need to see an oral surgeon or go through any type of these procedures that oral surgeons do that would help calm their fears.
I think a lot of it has to do with well, first, for like, if you take for granted that the oral surgeon that you're seeing is an oral maxillofacial surgeon, that he or she is trained well, is board certified ideally, and is basically experienced in whatever specific treatment modality you require, then it's really a matter of, do you get along? Do you trust this person? Is this somebody that you would want to entrust into your care too? I think as long as you understand that most of us are very well trained, are going to do the right thing. I think most people generally do the right thing. And again, you want to see somebody who's doing the type of procedure that you need done on a regular basis, to come back to this full scope concept. So oral maxillofacial surgery has multiple like subspecialties that fall underneath the umbrella of oral maxillofacial surgery. I personally do, probably more wisdom teeth than most anybody, and I do the same with dental implants. So if I were to say, what are my foci, like where are my focus, it's those two things, maybe exposures of impacted canines and some minor intraoral pathology. I have a partner who trained in head and neck cancer, basically resection and microvascular repair of that. And so, yes, I'm an oral maxillofacial surgeon. I could theoretically do that, but I wouldn't go to me for that, and so you shouldn't come to me for that. And that's really how I see it. Now, there are guys out there who dabble in a lot of different things, and God bless them, that's fantastic. But personally, we are specialists at oral maxillofacial surgeons. We're specialists, so it all falls under our specialty. But we as specialists are of the mindset that you should be treated by a specialist, right? Like, by definition. So if you're just going to be treated by a specialist, you should know in your heart, are you personally the best person to handle this specific issue? And if the answer is no, obviously, if you're in an area that's rural and you can't find somebody and whatever, and everybody's got different levels of skill and experience, but in my world, I got a guy under my roof who's going to be able to do it better than I do. You should see that guy. So you have to hope that the guy's ethically, or the surgeon is ethically driven, and understands him or herself.
I love the answers that you're giving me today. It's amazing.
Thank you.
So, if people would like to see you, you have a lot of offices, you train a lot of other dentists too. How do they get a hold of you? Where do they call? And what locations are you actually in? I know you have a list on your website.
Yeah, so I'll give you like a brief, like, little business thing. That's not what this is about, but I appreciate that. So my practice is Riverside Oral Surgery. We have 10 locations in northern and central New Jersey. I spend all of my time in my River Edge location, which is in Bergen County, which I said earlier is about 6 miles from the George Washington Bridge. RiversideOralSurgery.com is the way to get to us. I also have partner practices under our basically our support service organization called Max, which is just over my shoulder. In Max, we support practices in 5 states: New York, New Jersey, Connecticut, Pennsylvania, and Vermont. All of our surgeons are amazing and really are focused on the right thing. And that's actually how we all came together, because we're so in love with the specialty and doing the right thing, and trying to build an exceptional brand that Max was formed. So call me if you need me. that's that's it. Call me if you need me.
And what parting words of wisdom would you give anyone that is having difficulties with their mouth, not sure who to go to? What would you tell them to do?
Yeah, I think trust the process. Go in and just take the first step. Learn what your options are. I would caution people not to dive too deeply into search engines and things like that, because a lot of patients, especially patients who have fear and anxiety associated with a certain type of treatment, can become overwhelmed, and it actually could push them away rather than towards. So go in, find somebody who's trusted to someone you trust first, right? So if you have a family member who is happy with his or her dental care, start there. It may not be the right place for you, but it's at least kind of a warm introduction. Start there, get a sense, is this the right place for me? Is it not? Do I trust? Always trust your gut in terms of, like, is this the right situation for me? Maybe get a second opinion, not 10 opinions, but definitely kind of understand what your options are, and take the step, dip the toe. There's always, the only way out is through. So just do it.
Awesome. And thank you so much. You heard it here, guys. Dr. Jason Auerbach, the Bloody Tooth Guy. Thank you so much for taking the time to share your wisdom and expertise with us. I really appreciate it.
Thank you so much for having me. I really appreciate everything, for sure.